Hi, everyone, and thank you so much for joining us. Tonight's presentation is Boundaries, Burnout, and Bandwidth. We're joined by folks from Ascension, Illinois, Mental Health, and I know that's not the name, it's Behavioral Health. So my name is Sam. I'm the Community Engagement Librarian at the Barrington Area Library, and I'm joined by my colleague, Danielle. Danielle does a great deal of our programming and works with our young adult population. So this was a natural collaboration for the two of us. And then we wanted to bring in some folks who have experience and expertise across that kind of range of young adult, new adult, and parenting, who could give us some ideas of how to manage those changes. So with that, I am going to turn things over to Greg to get us started and take it from there.
Well, thank you, Sam and Danielle. Good evening, everyone. My name is Greg Ammon. Allow me to introduce myself briefly. I am the Senior Director of Clinical Operations for Ascension, Illinois, Alexian Brothers Behavioral Health Hospital in Hoffman Estates. And you may know us by a prior name, Amita, or prior name, Alexian Brothers Behavioral Health. We have been in clinical and operational partnership for years and decades. And as things happen, names sometimes change. However, the clinical service, the providers, the leadership is the same. So when you hear Ascension, Illinois, you can think Amita, you can think of Alexian Brothers Behavioral Health. A little background about myself before we get going and we start into our slide deck. I am a licensed clinical professional counselor, meaning I have been providing therapy and treatment services for 28 years now, really ranging on children through really end of life. And when I say end of life, I do mean hospice care and hospice support therapeutic services as well. In the last probably 15 years, really focusing on men and women who really struggle with depression, anxiety, mood struggles, change issues in their life, whether it be relational, career, or otherwise, and focusing with people on what do they really want in their life. And so with tonight's topic, I was asked to speak about managing life responsibilities, basically balancing how to manage being an adult and moving through the process of being an adult successfully. And I think, as everyone can imagine, that's a big topic. And I have 15 minutes. And so from that perspective, I really started thinking about this rather than speaking about skills such as time management or speaking about some of the skills that my partners Sierra and Donna are going to be speaking about. I decided to maybe speak a little bit more on the individual level about what an individual can do to make sure they are on the path that they desire to be on, that their life is matching what it is they're saying they want in their life. And if they're on that path, then really managing and living up to adult responsibilities kind of starts to fall in place. And so with that, I will ask that we maybe advance to the next slide. And I want to talk about some tools that I think we can look at, that we can evaluate and consider from the perspective of the adult perspective of understanding ourselves, understanding where we're at, and understanding where we're going. So I just get a kick out of this cartoon. If anyone listening is a pet lover, and if you've ever had a cat, I've had cats in the past, but I'm a recovering cat owner and now a dog lover. You know, cats do what they want to do. They've got their path. They know them. They're going to do what they want, when they want, how they want, where they want. And I think this cartoon, I just get a kick out of it because as much as they're on their path, their owners want them on a different path. The owners try to get them to behave, follow directions, stay off the table, don't knock things off. And the cat says, I hear you, but I kind of want to do my own thing. And so this reminded me of that challenge of how do you balance adult responsibilities? How do you stay on that adult path of meeting expectations? And the cat has no remorse. The cat has no regret. And so from a counseling and therapy perspective, what I want to talk to you a little bit about is a change process. And it's not a change process from the perspective of what might a person's significant other want, or a parent want, or a teacher want for us. It's more about what do we want for us and how to move along that pathway. So on the right-hand side of this slide is, I think, a pretty good image of what we call the model of change. So this would be a model that really creates a picture for us to look at that helps us understand when we are desiring to make a change in our life, it just doesn't happen. We just don't get an idea and always just do it and it works. There are steps we go through. And so I want to walk us through this briefly. And as I'm talking about this, maybe think about a change that you have made in your life, maybe in the last 6 months or a year. Maybe it's a change with a job, or you've moved, or a relationship change, maybe a health change. Could really be anything. And when we start to really get into the change process, we're talking about a point in pre-contemplation, that light blue arrow, where life is going along and everything's pretty okay. No big crisis, no big issues, until the arrow keeps moving and then something happens. Something changes, something's brought to us, something changes in our life or environment, and it creates some disruption. It creates some dysregulation, some discomfort, some distress. And we say, maybe I've got a problem going on. And we start to contemplate, we start to think about doing something different. Eventually, over time, that situation keeps going. We keep contemplating, I think we got a problem. I think we have a problem. I think we have a problem. And then we start to say, I'm tired of having this problem, or I'm tired of being in this situation, or I'm tired of not having some situation or opportunity. And we move to the next phase, which is preparing. We start to prepare and have intent to do something, to start to take action. Preparing, it's a unique area. It's preparing mentally, coming up with ideas, preparing by maybe searching internets or resources, preparing by doing things with ourselves, with our environment. Preparing is everything that leads up to taking the next stage, which is action. Action meaning I'm going to do something and I'm starting it tomorrow. I'm starting it today. Here's some things I'm doing. It doesn't have to be 100% all in action. It can be pieces that build upon pieces upon pieces. Now, eventually, all those actions start to tie into maintaining the change happening. So if I decided a year ago, my home is too small, I'm having triplets, I need more space, I need to be out of a single bedroom house, and this is upsetting to me, I'm going to start contemplating making a change. I'm going to start Googling, I'm going to start searching, I'm going to start looking for new places. I'm going to now start taking action, or I'm talking to realtors, I'm going looking at places, I'm starting to pack, I'm having a rummage sale, get rid of things, and then I move. Once I'm in maintenance, I've now achieved what I wanted as an adult. I'm there, I'm doing it, and now I need to maintain. How do I keep that going? Sometimes we fall backwards. That's the relapse part. Sometimes we fall backwards. I might be in that new place and maybe I really didn't realize all the yard work and the snow shoveling and the house maintenance that was needed. So I might start to relapse and think I want to go back to that one bedroom apartment again. And then I feel the discomfort, and then I work the process and I come forward. I shared this model as an example because I think that people viewing tonight can look at this and ask themselves, with the distress coming towards me, with the discomforts, with the requests for change, with the responsibilities coming for me. Where am I at in this change process? Am I even thinking about doing something different? Or is this coming at me? Is it not as distressing as I might think? This is an important model because sometimes a significant other, an instructor, a boss, a teacher, a coworker, a friend, they think you're at the action phase or you're doing things, whereas you might be really okay where you're at. So as an adult, part of, I think, the conversation with others about managing adult responsibilities is being able to say, I am or I am not okay with what's happening right now. And I am or am not ready to make change or am making change. And this slide helps give us words to the change process so that we can communicate it with others. And again, I give credit to the audience that as you look at this, you will understand maybe how you can start to use this in your life to help make decisions for yourself, but also communicate with others. Next slide, please. So along with managing adult responsibilities and that change cycle, it's important to be able to ask yourself important questions. As you're contemplating change, as you're taking steps, as you're taking processes, as people are asking you to take on responsibilities or new steps or changes or processes, you have to ask yourself, what are your values? What are your hopes and goals? And I present this slide to you again, giving credit to the audience that you would be able to ask yourself these questions and be able to be honest with yourself, to ask yourself, what is the most important thing in your life at this time? And if someone is presenting that responsibilities need to shift or a change needs to occur or anything along those lines, if you answer that question honestly and the request coming to you and the value that you say is the most important, if they don't match, you have to ask yourself, what are you going to do? Are you going to be the cat who stays their course and does their thing? Or are you going to follow the direction of the other at the risk of maybe your values being infringed upon? Hopes and goals. When you think about the future, what are some of the things that you would like to have in it? Really helping yourself or others think, dream, prepare. So again, as responsibilities, as requests, as actions come your way, as change is coming your way, as you are making change, do your hopes and goals match the change that's happening around you? Do your hopes and goals match the change and responsibilities that you're starting to take yourself down a path of? The point of this, as you can imagine, is that if you go through a change process and it does not align with your values, it does not align with your hopes and goals, you are going to be one unhappy adult at some point. At some point in your life, you're going to reflect, what happened? Where did I lose myself? Where did the important things in my life go? And to that point, that's a really valuable and hard lesson that I think all of us have experienced at different times. And so, again, I offer this slide deck as a tool to use to ask yourself questions, or maybe people in your life to help them ask themselves questions as well. Next slide, please. And lastly, this is a tool that I'd like to present to you. It's called a decisional balance intervention tool. And it's pretty straightforward. I believe everyone will be receiving these slide decks, so you can use this for yourself. What this is, it's more than a pro and con list. You see there's 4 quads, pros of change, and then the connection of not making change. What are the pros and cons of not making change? And as you go through these quadrants, the first upper left box, what would be some good things about making this change? You might start to come into all sorts of information, either in additional money, freedoms, independence. The second box, what would be some not so good things about making the change? Maybe the answer is I'll have a lot of anxiety. I'll have lots of doubts. I'll be confused. I won't have time with my friends. This is going to cause conflicts with people. The lower left box. What is the pro of not changing? So something like, it's easier. I don't have to learn anything. I don't have to study. I get to do whatever I'm wanting to do that I'm still doing right now. And the bottom right, the fourth quadrant. What would be some not so good things about not making the change? And this is really the root of a person's present status. I'll never get what I say that I want. People get fed up with me for not fulfilling my role. I'm stuck in this position or place, but I'm where I am now, and that's comfortable. Here's the intention with this, and I'm really going high level with this. This tool can create a GPS, if you will, of where a person is now and where they say they want to be. So imagine the lower right box, box 4, that's where a person is now. They say they want to get to box 1 in the upper left. Well, to get from box 4 to box 1, they have to go through box 2 and 3. Box 2 is the root of all their self-defeating thinking, all their rationalizations, minimizations, self-defeating thoughts that pull themselves down. They have to be able to conquer and overcome box 2. Box 3, it's the root of all their unhelpful habits, procrastination, drug or alcohol use, not being disciplined, not being focused, these sorts of things. To get from box 4 to box 1, to make that change, to meet adult life responsibilities, if a person can map this out, they've given themselves the GPS to do the work to get through here. Next slide, please. I just covered a lot of information. That would be about 6 months of therapy with a person doing this work. It is a slow process. My intention in sharing it is to give you a taste of some of the work we do. With Ascension Illinois, with our Ascension treatment framework, we focus on very purposeful interventions, empowering people to be able to make decisions for themselves by knowing themselves so that they can drive their lives forward. Next slide, please. That's just a cute slide. And next slide. This last page, these are our clinical directors to all of our programs. I share this because, again, I believe this will be made available to you. You can contact myself. You have my information at the beginning of the slide deck, as well as these professionals. These are our clinical directors. Sierra Gabbries is also going to be speaking with us tonight from this team. And we serve the broad spectrum of child through end of life issues and every specialty in between. So with that, simply because of time, I'm going to wrap up my section, hand off to my partner, Donna Bartlett. We will be available for questions at the end, just a reminder. And thank you for bringing you the tip of the iceberg.
Oh, it's actually, I think it's Sierra. I guess, Sarah, you go.
Okay, I can go. All right. Thank you so much for having me. I'm Sierra Gabbries. I'm the director of outpatient mood disorders. I oversee the outpatient program. We have a partial hospitalization program and an intensive outpatient program. And so I work with the adults in that population. I'm a licensed clinical professional counselor. I've been a counselor for 16 years. And have provided service to patients in a variety of settings, including outpatient, inpatient, and also nursing homes. So I'm happy to speak today about my work with adults and kind of knowledge I have about stress management and how to avoid burnout. I think this is especially important for young adults because understanding and developing these skills at an early age will really help kind of manage all of life's transitions from a really healthy perspective as you are encountering different changes and challenges moving forward and stressors. So I will go ahead and talk about stress a bit. If you can move to the next slide, please. Okay, so what is stress? We've all heard of stress. We all kind of, I think, have an idea of what that means for sure. But a definition is an uncomfortable emotional experience as a result of a certain stressor or stimuli, trigger, that causes a subsequent response in our bodies. And so it can cause a physiological response, a cognitive response, and an emotional response. And those all kind of work together collectively to have what we would call a stress response. So what does that mean? So physiological, thinking of what happens in our body systems. So we might have a surge of stress hormones like adrenaline that will cause responses that are adaptive to us and helpful, like increasing our blood pressure and heart rate, changing our breathing rate, sweating, moving blood from our internal organs to our external organs so we can, move or activate, some kind of action to keep ourselves safe if we're feeling stressed. Cognitive means the things that we think. So what is our internal mental dialogue, our thoughts? And so if we're under stress, we might experience like what we would call in therapy negative self-talk. So something like, I can't do this, or I'm going to fail at this. This is going to hurt me. So we might have those types of thoughts. And then the emotional response and how that's connected, we may have unpleasant feelings like frustration, irritability, anger, fear, or panic. So again, all of those things combined in our body systems will create that sensation and that feeling of stress. You can go to the next slide, please. So what are the phases of stress? So when we have a stress response, initially the first reaction would be what we would call an alarm phase. And that's when we have more arousal. And we've probably heard of fight or flight. So that experience, again, where it's those physiological responses, where our body kind of gets ready for action. We have, again, changes in blood flow, and sometimes that we might feel nauseous, upset stomach, other symptoms like that. Then the next phase after that initial alarm phase is what we would call resistance phase. And this is when our mind and body starts to attempt to adapt to stress. Our body can still maintain its normal functioning, so we're kind of resistant to the long-term effects of stress. So we're functioning normally, but our body is sort of building up some resistance and tolerance to stress. But we can only do that for so long. And so eventually kind of the constant hormones, the emotional changes will burn us out. And so the last phase of stress is what we would call burnout or exhaustion. And that's when we've had that chronic stress that has not let up, and we really just cannot function at the same normal level. And here is when we see a lot of problematic things, medical issues, difficulty sleeping, concentrating, but to such a severe degree that we just cannot maintain our normal level of functioning. I'll go through how to kind of work through and prevent that in some of the future slides, but you can advance, please, to the next. Okay. All right. I think it's important to mention and kind of differentiate as we think about stress, what types of stress there are. So we know what the response is in our bodies, we know the phases, and then how can we identify what would be an acute stress versus a chronic stressor? So when we think of acute stressors, we might think of things that are short-term or immediate. So for example, acute stress is going on a job interview, doing a presentation, getting in a car accident or a speeding ticket. So something that happens kind of quickly, one-time situation that would cause those responses in us, but then they're over. And it doesn't mean that they're minor. They could be major things like a very bad accident or incident, or again, minor, like some of the examples I gave before. But the idea is that it ends. Then people can deal with chronic stress, and that's more of a long-term or persistent stress over time. And the effects of chronic stress can be a lot more long-lasting and problematic, even if they're minor chronic stressors. So I just think it's important to differentiate between the two of those. Okay, you can move on, please. So how do you know, what are some warning signs that you're feeling stress? So the physical signs of stress are fatigue, headache, muscle pain, elevated blood pressure, chronic illness. And the list of these physical symptoms really can go on and on, clenching your teeth, difficulty with balance and coordination, etc. Some other behavioral signs of stress: interrupted sleep, under or overeating, under or over exercising, just engaging in things that we're trying to do to help cope and mitigate stress, but they're not necessarily healthy for us. You can advance. Cognitive signs of stress: loss of concentration, feeling forgetful, racing thoughts, which means our thoughts are moving really quickly and it's kind of hard to keep track of them or organize them. And then emotional signs of stress can be anxiety, depression, anger, mood swings, crying, just any kind of unpleasant emotion that we might experience. Thank you. So that's I've kind of broke it down in another way, and I want to highlight we have a long list in our program of warning signs of stress, and these are just a few more. So I ignore my own needs and work harder or faster than, maybe I can keep up with at work or at home. I feel keyed up or on edge, trembling or nervous tics, grinding of teeth, pain in the neck, shoulders, and back, misusing prescription medications, substance abuse, feeling easily fatigued or a weakened immune system. Okay, you can go on. Thank you. Okay, so how can I manage stress to prevent burnout? And I enjoy talking about this part because it really correlates. A lot of the things that I'll talk about can be applied to, I think, other unpleasant sensations or feelings other than stress. And it's certainly what we discuss when we teach our patients in program how to cope with our emotions. And I want to preface that a little bit by explaining that our kind of standpoint and viewpoint on that is that, our emotions are energy passing through our bodies. We try to kind of not label them as good or bad, but more pleasant or unpleasant. And so I'd like to ask you to kind of keep that in mind as I go through some things that we discussed. So kind of having more of a neutral standpoint on this conversation of stress. And why I say that is our goal is not really to ever eliminate stress, but it's how to manage it and how can it be useful to us. So in some ways, stress is helpful and adaptive. Our stress response can prevent us from getting hurt in a certain situation. It could cause some positive feelings of anticipation or excitement. It might help us meet a deadline. It might help us perform at our highest capacity in some form of competition. So sometimes not having enough of that kind of stress might leave us feeling kind of bored or kind of frustrated. And so it's, again, just learning how to balance stress so that it doesn't impact us in a negative way and be harmful to us. So when we can think of it in that way, it kind of changes our perspective a little bit. And so what do we do to manage stress? You can move on to the next slide, please. The first thing that we want to do is build an awareness of our stressors and our emotional and physical reactions to them. So a couple ways to kind of break this down is first, how are we noticing stress? Just asking yourself some questions like, okay, I'm feeling kind of stressed right now. So what is distressing to me? How did my body respond? So, kind of coming into work and seeing maybe a lot of emails and phone calls and things to catch up on. So, and then kind of saying, okay, wait, I'm feeling a little distracted, or I'm feeling that sensation in my body. What is causing my stress? How is my body responding? So just taking a minute to be aware of that in that moment, what is happening around you. So that awareness is key. You can go on to the next one. Recognizing what you can change. So asking yourself some of these following questions. Can you change the stressor? Can you reduce the intensity? Can you shorten your exposure? And is there anything that you can do to make a change? So you cannot change the number of emails or phone calls that you have to respond to. You might not be able to change the fact that there's a crying baby sitting next to you on an airplane, but how can you reduce the intensity or exposure? Is there a way to walk away for a few minutes? Is there a way to kind of organize your day to focus only on this for a certain amount of time and then move on to the next thing? And we can go on about that in long conversations, but the idea is, again, recognizing what you actually have the ability and power to change. You can go, thank you. The next one is reducing the intensity of your emotional reactions to stress. So are you viewing the stressor in an exaggerated term? So what that means is, are we interpreting, engaging our response in an appropriate way? So sometimes when we're already kind of stressed or tired, or our resources are kind of burnt down, we might exaggerate how negative the stressor might be. What are your expectations? Are you trying to please everyone? Are you trying to accomplish things to make other people happy? And kind of where is your motivation? And are we able to check that so that we can maybe adapt accordingly? Are we viewing things absolutely critical or urgent? Or can we take a stance of a more neutral stance of, I don't have to respond to this immediately. I can take a few minutes. And will that help reduce some of that intensity? Again, kind of what I was prefacing before is, with that in mind, adopting a moderate view. So somewhere in the middle of, this is important, but it's not critical or urgent. And how will I work to manage that? And then lastly, practicing healthy expression and perspective. So kind of going back to what I was saying before, that our emotions, we want to try to not judge them as good or bad, but express them. So I'm feeling frustrated, I'm feeling angry, I'm feeling overwhelmed, but then not leading into kind of the secondary judgment of that emotion of like, and it's bad that I'm feeling this way, or doing things that are unhealthy for us to express that emotion, such as getting aggressive or things like that. So just how can I healthfully and appropriately express myself? Can go to the next slide, please. Practice moderating your physical reactions to stress. So again, that's our breathing and our muscles. So practicing slow, deep breathing techniques, other relaxation techniques, exercising, and then certainly consulting with a doctor. And why that's included here is that if you do have other medical issues, there might be other interventions that might be necessary or important if you are having severe physical reactions to stress. So just making sure you're taking good care of yourself and managing your physical reactions, and then seeking additional help if needed. You can go on. And then improving your physical well-being. So the healthier our bodies are, the more efficiently we'll be able to do these things that we're discussing and help manage stress. So obviously having good nutrition, keeping yourself at a healthy weight, avoiding nicotine or substances, making sure you have leisure time and filling space with enjoyable, pleasurable things that make you feel good. And then of course, getting enough sleep. So all those things rejuvenate our physical well-being and help us manage stress. And then again, feeling connected to your emotions. And part of what helps us do that is having positive, supportive relationships with other people, setting realistic goals for yourself. Also understanding that you are going to have frustration as you go about life, and feeling that, understanding that you can have those feelings of frustration without letting it be so overwhelming. And then, of course, something we often talk about is just being kind and gentle to yourself. So learning who you are, learning how your body works, how your mind works, not judging it, and, again, treating yourself with love and compassion. Okay. And so if you're like everyone, we're always trying to do these things that keep us well and healthy and manage stress. Sometimes we're going through notable changes or significant stressors and we need some additional support. And so we would, of course, encourage you to seek out services through individual therapy or psychiatry, a partial hospitalization program or intensive outpatient program like we have at Alexian Brothers Behavioral Health Hospital, and other support groups. So all of these things would be a great resource, and certainly a decision about what level of care would be appropriate would be something to talk about with providers. But these are all options that are out and available in the community. And then this is our information for how to get help specifically within our program. We have an access department and call center. So our access department is at the main behavioral health hospital, and it's open 24/7. And we provide free walk-in assessments for levels of care. So basically, if someone is feeling that they need some help for their mental or behavioral health, and they're not sure exactly where to start, our access department will give them a free assessment, and that might lead to a referral to our PHP or IOP. They may be able to go back into the community for individual services, or if they're in crisis, we may need to intervene with a higher level of care. And then we also have our call center, and that number is below, and that's how you can access additional information and resources, as well as connect to our outpatient group practice for counseling as well. And that is all for me. I'll pass it off to Donna. Thank you.
Hi, so I'm Donna Bartlett. I am the community liaison for our child and adolescent programs here at Ascension Illinois Behavioral Health. I am a licensed clinical social worker, and also I have my master's in teaching. I have been working with children and adolescents probably for most of, if not all of my adult life in various roles, starting with truant officer, working as a school liaison, so helping kids transition back to school, and now kind of putting all those things together and being out in the community, working with schools, community organizations, truant, probation officers, whatever, to try to help ensure that our children and adolescents are able to get services that they need to help them thrive and be successful. I also work in private practice, and I work a lot with adolescents, families, and young adults. And so I kind of have been in this role for many, many years. So what I'm going to talk about a little bit is bringing together both what Greg and Sierra talked about, which I think we can relate to, obviously, as our kids get older, are managing change, and then obviously balancing stress for ourselves and our children. And so I'm talking about personal boundaries with relationships for parents and their children, and then obviously kids as they go on to college, managing those different relationships. You can take the slide. So I just want to talk about, obviously, when we raise a child who is comfortable enough to leave you, that means that you've done your job. They are not ours to keep, but to teach how to soar on their own. I know it's always a difficult thing as we help them grow, but obviously that's our goal. And so as we see a lot of our kids go off to college, or even after they graduate high school and moving on to different roles that they're in, that relationship changes a little bit. And so kind of helping manage that relationship and learn from each other is kind of what we're going to talk about. Next slide, please. So one of the most exciting things about college is that we learn new things all the time. So here's something that I learned, and it's from a British anthropologist, a researcher named Robin Dunbar. We did some research on social relationships and how many humans are able to maintain. He actually came up with an estimate that was about 150 social relationships. That obviously sounds like a lot, I think. In this day and age, obviously with our social media sites, different kind of areas that our kids are active in and we're active in, jobs, school, activities, that kind of then can narrow it down a little bit. But there's different layers, obviously, in that connection. But really, studies show that the closest emotional layer is the relationship that we hold the most meaning and connection, usually consists of about 5 people. Next slide. Okay, so I talk about reflection on time to time with our relationships. And so especially like as our kids go off to college or our kids move on from high school, which we know working with the population that I work with for sure, and Greg and Sierra, we see kids grow from childhood, adolescent. We see the different changes, obviously, as they go on from elementary to middle school to high school, and how those relationships and how they change and grow as people, as well as parents, like how that looks different, how we pull back a little bit, how we push in a little bit. And so one of the things that I think it's a great time to have kids have a little bit more insight and assess kind of their relationships from time to time helps them become more of who they want to be. And so some of the things that they can do internally to assess different situations is, how do I feel around my friends? How do I feel I am when I'm around them? What kind of energy do they actually bring into my life? Are they there for me when I actually need them? And if I'm there for them when they need me, how can I assess those things and what can I do? And so talking about, hey, if the answer is no to some of these questions, how do I kind of start parting ways from them? And we see that change. I feel like just working with this, like different populations of kids and watching adolescents grow, we see a lot of changes, obviously, in middle school, like 7th grade, 8th grade, relationships change, kids change, groups change. Going into high school, things change freshman, sophomore year, then definitely senior year, kids start to feel a little bit more comfortable in their own skin. And that's the hope, right? Because then they're going to be going off, leaving the nest some way or another, either college, like kind of going off on their own, finding jobs, doing trade school, whatever they do, but definitely having kind of the responsibility to do things on their own. So we want them to be able to kind of assess these things and know like who fits in my life and who doesn't. And sometimes, can I say, no, I can't hang out with you? And how do I do that? Like, sorry, I can't hang out tonight. I have to study for an exam. Or, sorry, I just can't go. My family needs me. Or I have some personal things I need to do. Or I really appreciate your opinion, but I need to kind of start making decisions on my own. Next slide. So now I talked a little bit about how can parents help kids, especially like when we're talking about college students moving out. What are some things to do? And it's like a little 5 short list to kind of help maybe alleviate some of that stress. So, or minimize it. And so some things that you do, help them pack, but allow them to do it. Obviously they get lists from their colleges, they get different opinions from different people, but allowing them to kind of make the choices, helping them and guiding them and giving them lists, embrace the list, right? Like have them get those lists from school, have them get those lists from other friends or peers, siblings that have already done it. And then obviously you, and then kind of coming up with a strategy on their own. I recommend definitely talking about money. It's different when they're away at college or they're away from home. That purse string looks a little different. They need to kind of recognize what a budget is, what do I actually need, as opposed to what do I want, and what makes sense for me to get at this time because of this, that, and another, whatever, budget-wise. Talking about budgets and helping them learn that. And obviously, like in some classes in high school, they're doing those type of things, but truly like living the budget or living kind of that policy. The hard part is obviously like I'm your mom or your dad, I'm not your friend. And how do I manage that? And how do I control that or keep that kind of without upsetting them right when they're about to leave our house? What are things that I should be doing? What are things that I can do to help support them as they move on? And how do I help still have some kind of structure or still have some type of ownership that I'm your parent, I'm not your friend, I love you, but you still need to study like when you're at college. You still need to be respectful of other people. You still need to have some kind of ownership in your own actions. And so having those conversations, and it's okay to kind of continue to talk about those things with your kids. And then obviously look them in the eyes and say goodbye when they leave. It's hard. It's definitely sometimes more difficult that first time. And sometimes it's more difficult the 10th time when you do it after you drop them off senior year in college, right? It's okay that they're okay. It's okay that they're enjoying college. It's okay that they're not needing your input every 5 seconds, because that means you did your job and you've done what you're supposed to do to help them grow. Next slide, please. And then I just want to talk about setting boundaries. It's hard when and even if they're not in college, if they're at home, that dynamic changes. They're 18 typically, 19 years old. And so some things are going to look a little different. You're not monitoring or checking that they're up every day to get to class. You're not checking their homework. You're not checking to make sure that they're showering even, or getting ready for their job, or getting ready for class, or getting ready to go out with friends. And so having the boundaries and maybe scheduling time to have a phone call weekly with them, having them be part of that conversation, allowing them to talk about their day and not really passing judgment and just listening and trying to kind of learn from them without kind of inputting, like putting your input on everything. Because again, we want to see them grow and thrive. We want to see them, like Greg talked about, the different changes. It's a big change, but change can be good and change can be helpful for them as they grow into adulthood. They need to kind of figure out some of this on their own, but definitely being there as a sounding board, reinforcing your beliefs in them and reinforcing your love for them. Listen and really try to listen to them and not always share advice, because sometimes they don't want the advice, although it's hard for us not to give it. I have a senior in college as well, but listening and kind of just trying to let them figure it out and come up with a solution on their own. And then obviously always letting them know that you're here for them and that you love them. That's always kind of the priority, and that's what they need to hear, regardless of kind of what happened that day. Next slide. Okay, I think that's it for me. Mine was quick.
Yeah, let me stop sharing. And I apologize for missing the cues. I was answering questions in chat or typing things in chat, and then when I would try to jump back to advance, it took a couple of clicks, so I apologize for that.
I think you did a great job.
Thank you. I do have one question that came in that I think I'm going to ask the group to try and address briefly before we stop recording, and then any other questions that, you know, I'm starting to again type a note in chat, but folks, if you have questions that you'd like us to put to the panelists, please go ahead and put those in chat now, and Danielle or I will be happy to address them for you. And that question was, I know you can't answer for every other institution that's out there, but if a student is away at school and either they're concerned or their folks are concerned, or friends at school or at home are concerned that we're starting to see some of those warning signs, this isn't just normal, how do I adjust kind of thing. What should they look for? How do they go about finding resources when they're not close to a meetup or Ascension? Sorry.
Sure.
Are we talking about, if we're talking about like on a college campus, the great news is that many colleges have resources on site. And so they have their wellness or health offices that they have the ability to have services such as a counselor or social worker right on campus. Definitely, like, I always recommend when you're even touring or visiting a college and you know that you want to attend there, that's one of the first places to look. And so, I mean, again, I feel like most colleges, if not all, and Greg and Sarah, you guys can jump in, but I was even just at Harper the other day, and we did kind of a little wellness thing, and they had people from counselors, they had a wellness group, and they have like several people there that were there and they were visible, trying to greet the student to let them know that, hey, if you have a need for anything, emotional, behavioral, whatever, mental health issues, they're there and they are willing to help.
Thank you.
Mhm.
Yeah, so I can jump on a little bit too. So I agree. I think being on a college campus, one of the really great benefits is that there is a health center right there. And the nice thing about a college health center is the integration with medical health and behavioral health, mental health. It's very symbiotic. So if a student comes in for a wellness check, a cold, bad headaches, tummy aches, some of the questions that will be asked will be things like, how are you adjusting to school? Have you had any major changes lately? Have you started to feel like you're a little more lonely? They're going to start doing some mental health checks that really start to tie over to depression, anxiety symptoms. And so I think to part of your question, Sam, about what would people be looking for if someone might need help? I think if you're at home and your child or your significant other or whomever, they're away at college, they're going to be starting to look for just some changes in their normal average baseline behavior. So if they're usually pretty chatty and outgoing, and now they're much more quiet and secluded, that's a red flag. Maybe it's an off day, maybe it's an off week. We want to take a look at behavior over time. So maybe they're more withdrawn. Maybe they're starting to talk about not wanting to get involved with some of the social activities that they do. Perhaps they're having conflicts with classmates or their roommates or people back home. Perhaps that first grade report comes out, and in high school or the prior year, they're pretty solid academically, and you've seen a significant decline. If you happen to be having a credit card with your child on their way at college, and you notice a spending habit that might be concerning, either on Amazon or at the local liquor store. The changes in what a person's baseline average personality and activities are would be those red flags that something's up. Now you ask them, they're going to say everything's fine. We as parents, we as significant others, we as friends, we need to be able to say, no, I know you, something's up. Might not be critical, might not be catastrophic, but something is up because this doesn't fit the you that you've been for the last 20 years, for example. And so I think having that conversation and then right back to what Donna was saying, connecting, if at all possible, with the campus counseling center or others in the immediate area.
Thank you. Good. And I think we will end the recording at this time. And again, just, to increase the comfort level in posing questions. So